New research is adding further weight to the argument that prolonged sitting may be hazardous to your health. An international study surveying more than 100,000 individuals in 21 countries found that people who sat for 6 to 8 hours a day had a 12 to 13% increased risk for early death and heart disease, while those who sat for more than 8 hours daily increased that to a sobering 20%. The study, co-led by Simon Fraser University Health Sciences professor Scott Lear and Wei Li of Beijing's Chinese Academy of Medical Sciences, is published today in the journal JAMA Cardiology. Their research followed individuals over an average of 11 years and determined that high amounts of sitting time were associated with increased risk of early death and cardiovascular disease. While sitting was problematic in all countries, it was especially so in low-income and lower-middle-income countries. The overarching message here is to minimize how much you sit, says Lear. If you must sit, getting in more exercise during other times of the day will offset that risk. Not surprising, those who sat the most and were the least active had the highest risk, up to 50%, while those who sat the most but were also the most active had a substantially lower risk of A. For those sitting more than 4 hours a day, replacing a half hour of sitting with exercise reduced the risk by 2%, Lear notes. With only 1 in 4 Canadians meeting the activity guidelines, there's a real opportunity here for people to increase their activity and reduce their chances of early death and heart disease. The study found a particular association in lower-income countries, leading researchers to speculate that clinicians should focus on less sitting and more activity as it's a low-cost intervention that can have enormous benefit, Lear notes. But while clinicians need to get the message out about countering sitting with activity, individuals need to better assess their lifestyles and take their health seriously, Lear adds. Our study found that a combination of sitting and inactivity accounted for 8% of all deaths, which is close to the contribution of smoking, 10.6% in Lear and Lee's study. It's a global problem that has a remarkably simple fix. Scheduling time to get out of that chair is a great start. Make a difference. Sponsored Opportunity StorySource. Materials provided by Simon Fraser University. Note: content may be edited for style and length. Journal reference: Sidong Li, Scott A. Lear, Sumathi Rangarajan, Bo Hu, Lu Yin, Shrikant I. Bengawala, Khalid F. Al-Habib, Annika Rosengren, Rajiv Gupta, Prem K. Moni, Andreas Wielgos, Omar Rahman, M. Y. Mazapuspavina, Alvaro Avizam, Idakin Ouz, Karen Yates, Fernando Lanas, Antonio Dans, Mark E. Association of sitting time with mortality and cardiovascular events in high-income, middle-income, and low-income countries. JAMA Cardiology, 2022. doi. 10.1001, JAMA Cardio. 2022. 1581. Cite this page, Simon Fraser University. Trade the chair for fresh air. Sitting time and cardio health. Science Daily, the 15th of June 2022. Simon Fraser University. 2022, June 15. Trade the chair for fresh air. Sitting time and cardio health. Science Daily. Retrieved June 15, 2022 from ift.tt/r6wfqlx Simon Fraser University. Trade the chair for fresh air. Sitting time and cardio health. Science Daily. ift.tt/r6wfqlx Accessed June 15, 2022. Thanks for watching. Please subscribe my channel for more videos.